What if within just months of starting a medication, you could actually see a real shift in how protected your heart is?
Yeah, it sounds almost too good to be true, but new data suggests it might just be the case.
We're diving into something really fascinating today, aren't we?
Absolutely. We're taking a deep dive into a fresh look at the results from the SELECT trial, a really significant study.
Select, right?
And this new analysis, it was just presented at the European Congress on obesity over in Malaga, Spain.
Okay.
It's all about understanding the early wins, for your cardiovascular health when using semaglutide.
Okay, so the Select trial,
Mm,
that was a big deal. For anyone maybe just tuning in who hasn't heard of it, what's the quick version?
Sure. So the SELECT trial was this major study. It involved people who were carrying extra weight or were obese,
Mm-hmm.
and they already had diagnosed heart disease, and this is key, they didn't have diabetes.
Right, no diabetes. Got it.
And what's really grabbed everyone's attention now is this new way of looking at the data, specifically focusing on how quickly semaglutide started impacting their heart health, like right out of the gate.
So our mission today is to figure out just how fast semaglutide can get to work protecting the heart. That's the question, really.
Exactly.
Can we see benefits even before, significant weight comes off or before someone even reaches the full dose? What did this early peak actually uncover?
Well, the main finding is, frankly, pretty remarkable.
Yeah.
So when the researchers looked specifically at the participants who unfortunately had a cardiovascular event early on in the trial,
Okay.
those who were taking semaglutide had about 40% fewer major adverse events. And that was at both the 3-month and the 6-month check-ins compared to the placebo group.
40% fewer at 3 and 6 months.
Mm-hmm. And here's the kicker. This often happened before they were even on the highest dose of the medication.
Wow, so 40% reduction in that short time frame. That sounds, well, incredible. What were your initial thoughts seeing that?
Dr. Jorge Plutsky, he led this research, right? He had some interesting things to say about this early action.
He absolutely did. Dr. Plitsky really emphasized this early action, as he called it, of semaglutide.
Mm-hmm.
He pointed out they were seeing these significant benefits within the first 6 months, sometimes even earlier.
6 months, okay.
And crucially, he noted this was happening before major weight loss occurred for most people, and also before most participants had worked their way up to the full 2.4 milligram dose.
So that suggests
That?
that the drug might be doing more than just helping with weight loss.
Precisely. It really points towards other mechanisms being involved early on.
That's a really key point. So for our listeners who might be hearing about semaglutide, maybe even for the first time, what exactly is it? What kind of medication are we talking about here?
Okay, so semaglutide belongs to a class of medications called GLP-1 receptor agonists.
GLP-1s, right?
Mhm.
We hear that term a lot. Yeah. It was initially approved quite a while back, actually, to help people manage type 2 diabetes.
Okay.
And even back then, in those patients, it also showed benefits for their hearts, which is a huge finding in itself.
Mm.
Then later, it was also approved specifically for weight loss in individuals who are overweight or obese and have at least one other related health issue.
Okay, GLP-1 receptor agonists. That still sounds a bit technical. How do these actually work inside the body? What's going on sort of under the hood?
Right, let's break it down. Think of these medications as sending sort of extra signals to your body, like a helpful nudge.
A nudge. Okay.
Yeah, a nudge to better manage blood sugar and, importantly, to tell your brain you're feeling full. Essentially, they mimic the action of natural hormones we all have called incretins.
Incretins.
Yeah, your body releases these after you eat. They help regulate blood sugar, but they also send signals that reduce your appetite.
Ah, okay. So you feel fuller, faster.
Exactly. This generally leads to people eating fewer calories, which can then result in weight loss, but also other positive health effects, as we're seeing.
Got it. Now, this new analysis, it's building on the original SELECT trial from 2023. Can you give us a quick refresher on the main takeaways from that first big study?
Certainly. So the original SELECT trial, the big one, it showed that in adults who are overweight or obese and had a history of heart issues.
Like heart attack, stroke.
Exactly. Heart attack, stroke, or peripheral artery disease. But again, no diabetes semaglutide reduced the risk of what we call MACE.
MACE, major adverse cardiac events.
Right. Serious things like heart attacks and strokes. It reduced that risk by 20% over a 3-year period compared to those getting a placebo.
20% over 3 years. Okay.
And it's important to remember, too, that the trial didn't involve specific instructions on diet or exercise. Participants just got the medication or a placebo alongside their usual care.
Right, so the original trial gave us that longer-term picture, 20% over 3 years. Now this new analysis is like, as you said, putting that under a microscope, looking much earlier.
Precisely.
What exactly were the researchers hoping to learn by focusing on this first year and especially those first, 3 and 6 months?
Well, the main goal of this new analysis was really to pinpoint the differences in cardiovascular events, the MEC events, between the semaglutide and placebo groups, but within just the first 12 months.
Okay.
And they really zoomed in, as you said, on the 3-month and 6-month marks. They wanted to get a clearer understanding of how quickly these benefits might appear.
And maybe why or who benefits most quickly.
Potentially, yeah. And to see if they could identify anything that might predict who experiences an early event, whether on the drug or placebo.
And who are the people in this study? Can you maybe paint a picture of the group involved? Because a sense of the scale.
Sure. It was a large and pretty diverse group. We're talking 17,604 adults.
Wow, that's a lot of people.
It is. Age 45 and older, about 72% were men. And they were recruited from over 800 locations across 41 countries. So a big global effort.
Definitely. And the criteria?
All participants were either overweight or obese, defined as having a BMI of 27 or higher, and they were randomly assigned to get either the weekly semaglutide injections,
Which they gradually increased.
right, gradually titrated up to the target dose of 2.4 milligrams, or they received a matching placebo injection.
Okay, so a really substantial, well-designed study. And what were the specific numbers then when they looked at those early timeframes, that 3-month and 6-month mark? What risk reduction did they actually quantify?
Okay, the numbers are quite striking. Within just the first 3 months,
3 months.
the group taking semaglutide experienced a 38% lower risk of ME compared to the placebo group.
38%.
Yeah, so numerically, that was 36 events in the semaglutide group versus 58 in the placebo group.
Okay. And at 6 months, did it hold up?
It actually got a bit stronger. Within the first 6 months, there was a 41% reduction in the risk of MAE in the semaglutide group.
41%.
That was 67 events compared to 113 in the placebo group over those 6 months.
And this is the really key point again, isn't it? We keep coming back to it. At both of those early stages, 3 and 6 months, most participants hadn't actually lost a significant amount of weight yet.
That's right.
And many weren't even on that full 2.4 milligram dose of semaglutide.
That is such a crucial observation. As Dr. Plitsky highlighted, they saw what he termed an early separation in the treatment effect. The lines on the graph started diverging early,
Right.
even without substantial weight loss for many and without reaching the full target dose. This really strongly suggests that the benefits we're seeing, especially these early ones, aren't solely a result of shedding pounds.
So if it's not primarily about the weight loss, at least not in those initial months, what else might be going on? What other mechanisms could explain these, rapid cardiovascular benefits? How might semaglutide be acting so quickly?
Yeah, that's the million-dollar question, isn't it? Dr. Plitsky proposed several potential reasons, and these definitely need more investigation.
Okay, like what?
Well, possibilities include the drug's known ability to potentially reduce inflammation throughout the body. That's one big area.
Inflammation, right. That's linked to heart disease.
Absolutely. Also, improving blood sugar control, even in people without diabetes. Lowering blood pressure slightly, maybe even having direct positive effects on the heart muscle and the blood vessels themselves.
Direct effects. Interesting.
Or it could be that early shifts in diet, maybe people just start eating a bit differently quite quickly because of the appetite effects play a role. Or, most likely, it's some combination of these factors and maybe others we haven't identified yet.
So, still some unknowns there.
Definitely. It's clear that more research is needed to really tease apart these mechanisms and understand exactly how it's working so fast.
Now, just to put this all into perspective again for our listeners, the SELECT trial focused on a very specific group. Can you just remind us who they were again?
Yes, absolutely. It's important context. SELECT was focused on what we call secondary prevention.
Secondary prevention.
Yeah.
Meaning
it included individuals who had already experienced a heart event or had established cardiovascular disease. It wasn't looking at preventing a first-time heart attack or stroke in people who were generally healthy apart from their weight. That's primary prevention, a different question.
Right, so these were people already known to be at high risk because they'd had issues before.
Correct.
And these participants, they weren't starting from square one in terms of managing their heart health, were they? They were likely already on other standard heart medications.
That's another crucial point, exactly. It's really important to understand that these individuals were, for the most part, already receiving standard of care, evidence-based cardioprotective medications.
Like statins for cholesterol, blood pressure meds.
Precisely. drugs to manage their cholesterol, drugs to manage their blood pressure. So what we're seeing with semaglutide here is an additional layer of benefit. It's providing extra protection on top of these existing essential treatments.
That makes the finding even more significant, really. It's not replacing those, it's adding to them.
Exactly. It's an additive benefit in a high-risk group already receiving good background therapy.
Okay, so let's try and bring this all together. What's the main message, the key takeaway from this new look at the SELECT data for us to understand?
I think the key takeaway is that semaglutide appears to lead to a surprisingly rapid decrease in major cardiovascular events, AAC, in people who have pre-existing heart disease and are also overweight or obese.
Rapid being the operative word here.
Absolutely. This benefit seems to kick in relatively quickly, within the initial months of starting treatment. And crucially, even before significant weight loss happens for many, or before they even reach the full target dosage.
So the real aha moment, the sort of surprising part, is that the positive impact of semaglutide on heart health might go well beyond just the weight loss aspect.
Yes.
And it could involve these other mechanisms impacting the cardiovascular system and, well, these effects seem to start happening pretty darn quickly.
Precisely. It suggests a more, maybe comprehensive and faster-acting benefit on cardiovascular health than perhaps we initially thought, with potentially multiple factors at play right from the early stages of treatment.
Okay. And what does this mean for you, the listener? What are the practical implications of these findings?
Well, if you, or perhaps someone you know, falls into this specific category, so individuals with existing heart disease who are also carrying extra weight or obese, this new information is potentially quite significant. It suggests that semaglutide could offer relatively rapid protection for the heart beyond its effects on weight or diabetes. It's definitely, I would say, a topic worth discussing with your healthcare provider.
To see if it might be a suitable option for their specific situation.
Exactly. To weigh the potential benefits against any risks and see if it fits into their overall treatment plan.
This is really compelling stuff. It definitely makes you wonder, doesn't it? Given these early benefits, what else might we discover about how semaglutide impacts the body, maybe in other ways down the line? And how could this kind of knowledge further revolutionize how we understand and manage cardiovascular disease in the future? It certainly gives you, well, food for thought.
It really does. We're likely just scratching the surface.